Hi, so I just got my first shot of the COVID vaccine, Moderna specifically, and I wanted to describe the process just because I found it to be a very involved and mysterious process actually getting in to get the vaccine once I found out that I was eligible for it. So I'm hoping I can maybe demystify it for other people. First of all, so I'm a support worker for someone who's physically disabled. So that means I help her with daily tasks like getting out of bed and taking a bath and eating and taking medication. So I actually don't really consider myself a healthcare worker, and I wasn't expecting to be categorized as a healthcare worker, but actually probably a couple of weeks after they were already vaccinating healthcare workers in San Francisco, I found out that I was categorized that way. You should also know if you're in California, if you are somebody like me who does my type of job, you're considered a healthcare worker. And also, if you're caring for a family member who has certain high risk developmental disabilities like Down syndrome, you can also be categorized as a healthcare worker. Um, I personally don't really agree with this. I think it's really more important that the vaccine should be going to people who are in really high risk non-healthcare jobs, like people who work in grocery stores or restaurants and stuff like that. Um, so, if I could choose to have my vaccine dose go to somebody else, I would. But as it is, I feel like if you're eligible to get it, you just should get it because you can't really control who it goes to. Like, all you can do is make sure that you're vaccinated so that you don't spread it. I'm going to read from something in the New York Times that I saw, which was basically medical ethicists giving advice to people who are in this situation, who have been offered the vaccine and don't feel like they needed it as much as other people. It's entirely possible that the vaccination you decline will be given to someone at lower risk than you. Worse, it could get thrown away if it's not injected before it goes bad. Discarded doses do no one any good. So, after I found out that I was eligible, I really wanted to get the vaccine. And several weeks went by where I couldn't figure out how to get it at all. Apparently, this is something where California has been behind all the other states in terms of our vaccine rollout. Every time I went to look at the websites for the major hospitals that were providing the vaccine, all they said was, "We're giving it to healthcare workers right now. We'll contact other people when it's their turn." And it was like, well, I'm supposed to be in this category, but nobody has contacted me. Obviously, if you don't work for a hospital and you're not you know, like for example, like some people who work in my kind of job, if they work for an agency instead of being self-employed like I am, they were able more quickly to get information about the vaccine and get an appointment because they got it through their agency. Or if you work at a hospital or a clinic, maybe not at a clinic, but if you work for a big hospital, it's easy for you to logistically get set up to get the vaccine. And kind of the less that's the case, the less you're involved with like a big agency or hospital, the harder it is to figure out how to get the vaccine. So basically, I couldn't figure out how to get it at all. And I increasingly was getting some information from the regional center, which is the center that basically funds my job. And they were telling me that, people in my line of work could get the vaccine and providing a letter to bring when you get the vaccine to show that you're a healthcare worker and all this stuff. But I still wasn't really finding a way to actually get it. And I had just switched healthcare providers, so I was between doctors, so I couldn't really contact my doctor. When I finally got set up with a new doctor, with my new provider, after I tried to contact them, I was told that I was supposed to use this other website to like sign up to get the vaccine through my provider. But when I finally went through that whole website and filled out everything, they just told me that there were no appointments for the vaccine. So finally, on Monday, after I had been working on this for a couple of weeks and getting very confused, like I was really at a point where I felt like I was kind of being gaslit as to whether the vaccine was actually available to me, because it's like, okay, you're saying that all of these people are supposed to be eligible, but if we can't actually get it, how eligible are we? But so finally, the city of San Francisco put up this website which initially was kind of disappointing to people because it seemed like all the website did was just have you fill in your information and describe yourself and your situation, and then notify you once you're eligible to get the vaccine. But once I filled it out and they told me that I was eligible, they actually sent me to a helpful page where they were like, hey, if you are a healthcare worker but you don't work for a hospital or anybody else who can vaccinate you, and you weren't able to get vaccinated through your provider, here is a list of like three hospital systems that are vaccinating people. So I went through there. The first one was my provider, which had already been a wash. The second one was a different healthcare provider. So at this point, I'm expecting to find no appointments anywhere. And I go to their website, I go through the really long, involved process of, having to like make an account on this healthcare provider page, which is kind of like, I'm wondering like if there's some people, like older people, who might not even have been able to figure out how to do this, which is kind of another barrier. But I fill out this whole huge long account and I finally finish it. And once again, it says there's no appointments in San Francisco to get the vaccine. And, I look for like, I have them search for like all the appointments in the whole state, and the only appointments are like on the other side of California, like way far away places that I can't go. So I'm almost at the end of my route, but I finally go and look at the final hospital, which was the University of California, San Francisco, UCSF, and turned out I was actually able to make an appointment there. They had tons of appointments. The only two problems I had were they then were wanting me to make an online account with their hospital system, but so that I could check in for my appointment. But whenever I tried to do it, the page would like crash and not work. And then the other thing that happened was they had a list of like documents that you were supposed to bring to prove that you were a healthcare worker, but because I'm self-employed, I didn't have any of them. Like the center that funds me just pays me directly, and I'm self-employed. I pay my taxes out of that, so I don't get pay stubs or anything. So, I just brought my tax forms and stuff and the letter from them and showing that I was vendorized, that I'm contracted with them. But it was I was really a little stressed out that after all this, I would go in and I would be trying to get the vaccine, and, they would be like, well, you don't have like the exact right documents. You don't have a pay stub, so we won't vaccinate you. So anyway, like a week went by. I had made my appointment and I went to get my appointment today. And when I went in, they were asking everybody in line, did you sign in through the hospital online account? And I was like, no, I didn't check in there because I wasn't able to make an account. And this is after I've heard like several people in front of me that say the same thing, that they weren't able to make an account. So they told all of us like, well, you won't be able to get a vaccine unless you check in, so you have to make an account. And we were all like, but we can't. So finally they had to take all of us who were in this situation and make us wait on this bench. And finally, like one by one, we were all brought into a room where like a wonderful lady helped us make an account. It turned out that we needed a special code that we hadn't been given. And yeah, this lady was so kind. Like, I had done so many dumb things. Like, I had accidentally signed up for 2 appointments because I was not sure whether it had gone through. And she was like really nice and said that like multiple people had like signed up for like 4 appointments because they were so stressed about getting the vaccine. But anyway, this woman was like an angel. And so I finally was able to set up my account and check in. So then, like all the other people, I was finally able to go back and go through one of like several checkpoints. Um, of course, I get all stressed about proving that I'm a healthcare worker, and I give the person like this huge sheaf of papers that has like 900 kinds of documentation of my work. And they actually didn't even look at it. Like, the only thing they looked at was like a letter that was written by me that was just on the front explaining what documentation I had. But after all that, I was finally able to go and get vaccinated, and it was other people that I know have had side effects from the vaccine, like a headache and a sore arm. I haven't had any physical side effects at all. I also felt the vaccine was very gentle. I feel like it was like the least painful shot I've ever had. And after you have it, they make you wait for 15 minutes, like after you get a flu shot, to make sure that you don't have an allergic reaction. And yeah, of all the people that I saw, nobody had a reaction. And yeah, that's it. I got it. I will, I may make another video about getting the second shot. I'm not sure. I think I probably covered everything there is to say, unless I have some kind of side effects, which I may make a video about. Because I mean, I know a lot of people do have bad side effects. It's still worth it, but I understand that, like, because it's a new vaccine, it can be scary just because, you know, people aren't really familiar with all the side effects. So if you're in pain or you're feeling bad after you get the vaccine, it can be kind of scary if you don't know what's going on. Um, but yeah, I'm lucky that hasn't happened to me. So I think that's everything. I hope that this was helpful to somebody. Like I said, you know, even if you don't think that like you should be high priority to get the vaccine, if you are eligible, you know, there's still some, you still have the ability to catch COVID and spread it to people, whether it's like when you're riding the bus or when you're at the grocery store or something. So if you're eligible to get the vaccine, like, you know, I don't want to sound like a class warrior, but like the fact that like, you know, people who like work for hospitals and like are higher up and are working from home, the fact that like those people were vaccinated before nurses and doctors, like, you know, I just feel like if you're like a regular person who has to leave the house and like take public transit and go to work, um, and has much more of a chance of catching COVID than those people, then like you really shouldn't sweat getting the vaccine as soon as it's available to you. And I hope that you do. Okay, that's all.